Good evening. I am Dr. Morika. Yeah, I hear that you're in here for something in your eye. Okay. How long has this been bothering you? For quite a while. Okay. That's perfectly fine. We'll take a look at it. And then you also said there is something around the skin of your eye that is also bothering you. Do you think that those two things could be related? What time did they start? Okay. Around a similar time, okay. Were you around any substances that you weren't usually around? Something that you might be allergic to? Okay. Sure. That's okay. I'm just asking some questions to try to assess what we might be dealing with, okay? Just gonna ask a couple of quick, boring questions and then we'll proceed to the exam, okay? Good. I would like your first and last name, please. Okay. Perfect. That's what I have. And then also your birth date. Okay. Perfect. That's what we've got. Okay. So, you indicated that the skin around your eye became rather red and irritated. And I do see that, okay? It's very irritated, for sure. I do see a small amount of scabbing on the outside. Have you been picking at it, or scratching, or anything like that? Okay. A little bit, okay. Try not to do that. Scratching can spread bacteria and could really cause problems, and with the eye you could scratch it and you don't want an eye infection, okay? Okay. Have you tried looking in the eye yourself? Have you seen anything foreign in there, like maybe an eyelash, or even something like a shaving of wood, or anything really small? Okay, you have tried, but nothing. You don't see anything in there, okay? No worries. I will take a look more thoroughly, okay? Good. Alright. Is there anything else that you can tell me surrounding the situation? Okay. That's alright. Okay, so I think the first thing that we're going to do is I'm just going to take a look at the outer eye, okay? Just the skin surrounding it, and yeah, I'm gonna get it cleaned up. I do have some ointment that I would like to send home with you today, okay? But I'm gonna make sure that we're not dealing with any sort of infection. And if we are, we're gonna try to take care of it so it doesn't get worse, okay? Yeah, there's absolutely no reason to feel nervous, okay? I am here to take care of you. Yeah? You just stay with Dr. Morika and we'll get you fixed up, okay? Yeah, we'll get you fixed up. Okay. Let me just wash my hands. Just a little alcohol on the skin here, some hand sanitizer. Just to cleanse my hands before we start touching, okay? During the exam, I will have to get closer to you and I will have to touch. Is that alright? Do I have your consent? Wonderful, okay, good. Grab some gloves. If at any point during the examination anything becomes too much for you or you would like me to stop, just let me know, okay? Good. It's a busy day out there. Are you coming from work? Okay, yeah, the day off, good. Those are always really nice. The weather's been wonderful. I have some time off coming too, but I'm a little bit of a workaholic. I like to take care of my patients. Okay. So I have a little light here, okay? I'm just going to take a look at the general area. Okay. Just go ahead and look up for me, okay? Good. Just look up a little bit. Perfect. Go ahead and tilt your head just to the side, okay? Good. Perfect. Definitely seeing a lot of irritation around the skin, but luckily there aren't any signs of infection. Definitely a little swollen, I think probably from the extra scratching, but as it stands now, I'm going to give you, I think, a little bit of cream, I think, just because you do have a couple of open wounds on there, okay, just from the scratching. It's very important that you do not scratch your skin when you have any sort of irritation or, even mosquito bites and things. You just don't scratch them, okay? I know it's really hard, but you can spread bacteria, and pretty soon it's an infection and it's taking you a lot longer to get better than you otherwise might have been, okay? Let's go just a little closer, okay? Just a little closer. Okay, I'm gonna go around and then go ahead and look down for me, okay? Good. Just look down a little bit. Good. Perfect. Okay, and then with your head straight forward, I just want you to shift your eyes this way, okay? But keep your head forward. Okay. And shift your eyes back that way. Okay. Good. Okay. So, I think what I'll do is I'm just going to clean up the area around there, apply a little ointment now for you, and then I will send some home with you, okay? This is just a we don't want to irritate the skin even more. Okay, good. Very gentle here. Just relax. I am here to take care of you, okay? This won't hurt a bit. This won't hurt a bit. There we go. Good. Just relax. Tap, 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 tap. Okay. Skin is looking much better. Still very inflamed. The cream will probably help take that down a little bit, and I'm gonna want you to use it as needed for at least a week, okay? You should feel some instant relief with the cream, okay? You shouldn't feel any itching or irritation. If you do, I would highly recommend discontinuing the cream. Give us a call here at the office and we'll find something else, okay? There's more than one cream, for sure. This is just the one that we use most often, okay? Okay. Okay. Just have a clean cloth with a little bit of the cream on it, okay? And we're gonna go ahead and just very gently dab this on, okay? Ready? Dab, 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 dab. I don't really want to wipe because the skin is so irritated. I do have one more question. Were you itching the skin around the eye because the skin is irritated? Or were you itching because the eye was irritated? A little of both. Okay. That's okay. That's alright. Not to worry. Okay, good. It's looking a little better. Now let's tackle that eye, okay? So, I'm gonna scoot a little bit closer to you even more, okay? So I'm not going to stick anything into your eye, okay? I have a nice clean scope here, and I'm just gonna very gently open the eyelid, okay? Your instinct is going to be you want to close your eyes. Try your very best to keep them open, okay? Okay, ready? We're just going to look at the eye, okay? And good. Okay, good. Well, there does appear to be a foreign object in there. I think we can go ahead and take care of it, but it definitely has irritated your eye. Lots of redness. Okay. Nothing to worry about though, okay? There's no scratches or anything like that. But it's been in there for a really long time. So what I'm going to do is I'm going to take a Q-tip very gently and try to move it to the corner of the eye where we can take it out, okay? just gonna be here and we're just gonna try to move the item here, okay? I'm gonna just try to move it just a little bit so that we can go ahead and extract it, okay? So just hold still, the stillest that you can, okay? I know this is not very comfortable, but you're gonna be just fine, okay? You're gonna be just fine. Good. And bringing it down, okay? Bring that open again. Just go down. There. There we go. There we go. We've worked it over to the corner, so that's good, okay? So let's just... And there we go. And that's something in your eye. I cannot tell quite what it is. But it's coming. We're almost there. Just hold on a little bit longer, okay? Good. Good. There we go. And there. There. Okay. It does look like perhaps like a small bit of wood. Do you know where that might have come from? Not sure. Okay. Your eye is pretty red, okay? I'm sorry about the manipulation there, but I'm gonna put some drops in there and that should help it feel better, okay? I'll send the drops home with you and you're gonna want to use this as needed, okay? There we go. Going to just clean a little bit up here, okay? Just make sure everything is smooth and there's not any goop or anything, okay? Good. Perfect. Good. Okay, good. And that. No, I think everything's gonna be just fine. No scratching of the eye. No infection of the skin. Yeah, you're lucky though, okay? So, if this happens to you, try not to wait so long. The sooner you can get in, the better, okay? Yeah. And then also no scratching, okay? Never scratch if you can help it. Good. Perfect. There we are. Perfect. Alright. It's looking much better. Okay. How's the eye feeling then? A little better, good. But still feeling very irritated, yes. It did take quite a lot to get it out of there, but it didn't appear that we did any scratching or there was any damage present ahead of time, so It will probably feel irritated for a little while, but over time it will heal okay. Good. And then I'm just going to write you a prescription for the cream for the eye as well as the drops, okay? I would get these filled right away, alright? Okay. Perfect. And just try to stay on top of it, okay? Yeah, you don't want the irritation to kind of flare back up. Okay. Is there anything else I can do to help you today? Wonderful. I'm very glad to help, okay? I hope you're doing better soon, and if there are any questions or any concerns, please don't hesitate to call, okay? Alright. Well, you have a wonderful night, and I can hear lots of traffic out there today, so you be careful, okay?